Hi, I'm one of the doctors at our clinic. This video was created to let you know about getting an IUD. The part of the body that causes periods to happen is called the uterus. It is located at the top of the vagina. When the lining of the uterus builds up, it causes menstrual bleeding. The IUD has medicine inside that stops the lining of the uterus from thickening. If the lining doesn't get thick, it is totally safe to have lighter or no periods at all. In our clinic, we use the IUD for many reasons, like to stop or lessen menstrual bleeding, to stop pelvic pain and cramping, and also to keep the lining of the uterus safe and healthy. You probably already know that the IUD is a type of birth control. When birth control isn't used, pregnancy can happen because sperm travels into the uterus and meets with an egg in the tube. The medicine in the IUD traps and stops the sperm from ever meeting with an egg. The IUD works really well to prevent pregnancy, but it's not perfect. It also does not prevent infections. The medicine in the IUD works for 7 years, and then the IUD can be easily removed and a new one placed. A person can decide at any time to have their IUD removed. When someone decides to get an IUD, they need to have it placed by a doctor. For most of our patients, the placement procedure is done in our office during a regular clinic visit. At this visit, please be able to give us a urine sample, as we do some basic tests on everyone before they get an IUD. Less often, patients have their IUD placed in the operating room after they have gone asleep from anesthesia. The first step to getting an IUD is a pelvic exam, where the doctor feels the size and direction of the uterus. The next step is the speculum inside the vagina, where the doctor can see the cervix, which is the lower part of the uterus, and has an opening that will allow us to place the IUD. Next, we measure the length of the uterus and then place the IUD inside. When patients have the IUD inserted in the clinic, they often feel pressure and then cramping. The procedure takes just a few minutes and feels different for every person. A heating pad and over-the-counter pain medicine can help with cramps that may last for a few minutes, hours, or days. Bleeding can range from none to a normal period flow. There can also be spotting and brownish discharge that can last 3 to 6 months. Our doctors and nurses are here to answer any questions at all that you or your family may have about getting an IUD. And thank you for watching.